Chair Sear and Honorable Committee, I'm really honored to testify in support of S1336, an act expanding access to certified nurses' aid certification process. My constituents will speak in greater detail. I'm also here, of course, in support of its companion, H3609. My constituent, Laurie Millman, is the director of the Center for New Americans. The Center for New Americans is a community-based education and resource center, which has been welcoming and serving immigrants in Western Massachusetts for more than 30 years. And Asani Furaha is a former nurse with Doctors Without Borders in Burundi. She is a refugee from the Democratic Republic of Congo, who took English and nursing assistant classes at the Center for New Americans, currently works as a nurse's aide, and has applied for her US citizenship. Laurie and Asani will explain why this bill is crucial. Very, very simply, it does 4 important things. It significantly expands the language in which someone seeking a nurse's aid certification can take the exam. It gives DPH the ability to create the exam based on solid national standards and allows for a practice test. Number 3, if a student does not pass the exam, it mandates that students are informed about where they are in need of further study, pretty common sense. And finally, it allows for students to work for 6 months, during which they are preparing for the exam without being having to have passed that exam. I'm really grateful for the leadership and partnership of Representative Chan. And of course, you heard from Senator Keenan. You have heard of the efforts and how far this bill traveled last session. Now is our chance to finish the job, Mr. Chair. So I request a favorable report, and I'll turn it over to my great constituents. Thank you for taking us.
Thank you, Senator Comerford. My name is Laurie Millman. I am the director of Center for New Americans in Western Massachusetts. I am speaking in support of Senate Bill 1336, and I also want to appreciate Senator Keenan's testimony. Center for New Americans has been funded by the Department of Elementary and Secondary Education to offer nurse aid training to immigrants for the past 5 years. The grant requires that nurse aid students be co-enrolled in our classes of English for speakers of other languages, ESOL, so that students finish our program proficient in English and with a work-ready certificate. As you know, there is a tremendous need for certified nurse aides as our population ages. Long-term care facilities contact our program regularly to recruit our students. Many of our nurse aid candidates were trained as nurses in their home countries. Some seek nurse aid jobs while they re-credential as nurses. Others have not been trained as nurses, but they come from countries with caring traditions and have served as caregivers for elderly relatives. When our students are hired as nurse aides, they are regularly asked by their employers to work on their off weekends because the facility is short-staffed. Anyone who has visited a loved one in a rehabilitative facility has experienced the impact of the healthcare worker shortage. Our experience with multiple test vendors is that our students pass the clinical exam easily. They can demonstrate skills mastery. The written test is not accessible to non-native English speakers. Why? It does not accurately measure what students know and can do. It measures how familiar they are with multiple choice test-taking strategies and decoding arcane languages. Many questions are phrased in the negative. Which of these is not the job of a nurse aide? At Center for New Americans, several retired RNs volunteer as tutors. We have purchased more than 300 practice tests from D&S Technologies, the current test vendor, to help former students prepare to retake the test. Our immigrant students are persistent and determined to secure this credential. The tutors note that some of the questions are out and out wrong, do not correspond to the DPH sanctioned textbooks, and are irrelevant to being an effective nurse aide. D&S is much easier to work with, by the way, than the infamous Prometric, but that does not mean that their tests are any more accessible to immigrants. Interestingly, U.S. Citizenship and Immigration Services is currently engaged in a redesign of the citizenship test. They are inviting ESOL programs like ours to have students try the new test so they can learn whether the language is accessible to intermediate level students. If we have any hope of addressing the healthcare worker shortage with prospective candidates who are qualified and committed to offering caring service, we must redesign the test to clearly and accurately measure what nurse aides know and can do. And I invite you to hear from my colleague, our former student, Asani Furaha.
Good morning, my name is Asani Furaha. I am refugee from Republic Democratic of Congo. I was nurse there. I worked many years. I worked with Doctor Without Borders. I worked with another organization, international. I was a nurse in camp of refugee. And I worked different hospital. I have a large experience. I came here in the United States 2018, and I went to become a CNA. I took my CNA class at the Smith vocation. After that, I took my test, and my clinical test, it was simple because I passed the first time. It is a thing, is my skill. And when I took my knowledge test, it was very hard because language. I took this one 4 times, and I failed 3 times. When I failed, I talked with people in the Red Cross if I can took this one in my language, but they said no, because I didn't understand the question. I keep going until I passed my knowledge test in 4 times. I got my CNA certificate, and now I am CNA. I work, I do good job, because now I work, I have 2 jobs. And my place where I work, people appreciate me. After that, I already bought my house in Florence, in Northampton. I live there with my husband and my kids. We are okay. And my dream, my opinion is to become a nurse in the United States. Thank you.
Thank you for essentially sharing your journey with us, and glad you're settling in Florence. Other questions from the committee? I want to recognize my co-chair. Oops. Someone's having some sneezing issues online. Remind folks to mute. Want to recognize my House co-chair, Representative Decker, who's here this morning for the campaign. Also, I think, Representative, I want you to notice the updated microphones we have here. This is big news in the State House, and I know you were a lot instigated to get this done. Representative, and then I see Representative Kearns.
Thank you. And congratulations.
Representative Kearns.
Yeah. Yeah.
And so your practical experience, that was not enough to override the grid mix. You had to keep taking it.
Yeah. You know, the knowledge was very hard because, you know, you do some things in language, and there's a question sometimes I don't understand because the language. But now I keep taking my English class. Now, this one is 5.5 years in the United States. You know, you practice language, you are addicted, it's not easy. But I keep going because I want to be a nurse in the United States. I just started with my...
And can I clarify? Ultimately, even though she has worked as a nurse with Doctors Without Borders internationally, she will need to pass the NCLEX nursing exam in order to work here as a nurse. So many of our immigrant students who were nurses in Haiti, in the DRC, have to start as nurse aides so they can pay their rent until they have enough English to pass the NCLEX. But, you know, this bill is part and parcel of a whole recredentialing issue, because even our nurses who pass the NCLEX only receive a provisional license until they pass an English test. So we don't make it easy to take advantage of very qualified people. And I'll tell you, I defy anyone was trained as a nurse in the US to do what she did in a refugee camp, or our Haitian nurses do without supplies in Haiti, but we make them jump through hoops to get re-credentialed here, and we have a healthcare shortage.
Thank you.
Yeah.